Our first question of the night comes from Terry in Broadview Heights. And Terry wants to know, why are dosages, doctor, determined by age and not weight?
That's a great question, as the doses are all a little bit different depending on how old and the ages. But it turns out with vaccines, unlike other medications that we use to treat children, vaccines are based on, we say, developmental biology.
Yeah.
Your immune system is different as an infant versus a teenager and as an adult. And so what the researchers did in their studies were they found the appropriate dose based on the developmental age of the child.
All right.
And so it's not based on weight.
Good answer, good information. We go to Sarah. She's in the newsroom.
Yeah, thanks, Jimmy and Dr. Forbes. Now, I'm here with Dr. Kimberly Giuliano with Cleveland Clinic. And one of our viewers, Dr. Giuliano, she wrote in, my child will be turning 12 at the end of November. Should I get her the pediatric dose now or wait until she's 12 so she can get the adult-sized dose?
So I'd recommend getting the vaccine as soon as you possibly have access to it. The longer we go unprotected, the greater our chances of getting an infection would be. And we are really reassured that the effectiveness of the lower dose for the 11-year-olds is really, really high. So getting that lower dose today is probably going to provide just as much immunity as a higher dose would in just a few more weeks. So if we have access to it, I'd say go for it now.
Yeah, as soon as you can.
Yeah.
All right, Dr. Giuliano, thank you so much. Let's get back to the Health Hub where we find Monica Robbins.
Thank you so much, Sarah. Dr. Edwards, I'm going to start with you. How can I trust this when the child research was just a couple of months long?
You know, that's a really great question, and it's one I actually get a lot. But what I want to emphasize is pediatric vaccine trials are actually always fairly short. We don't think about that because we actually see that the whole trial might last several years. But the actual reason for that has more to do with logistics and enrollment and things like that. But what you actually only need for pediatric vaccine trials is a couple months of safety data, usually 3 or 4 months is the standard, and then efficacy, which we already have both of those. And so there's nothing about this vaccine trial that's different from other pediatric vaccine trials.
So this was just mainly looking at safety, right?
Safety and antibody response and vaccine efficacy. They actually did all three.
Okay, Dr. Bigham, let me move on to you. This question is about a rare heart condition in kids that can be triggered by the COVID-19 vaccine. So this questioner says, I'm afraid of giving my child the vaccine because of myocarditis. Isn't there a high risk?
Sure. I think it's important first to understand what is myocarditis. It's an inflammation of the heart muscle. That inflammation can sometimes cause heart rhythm abnormalities. It can also cause heart dysfunction. But in order to answer that question fully, we need to think about two things. We need to think about what is the risk of myocarditis with the vaccine. So in the youngest kids, those kids 5 to 11, they found no cases of myocarditis. In fact, they were careful after they enrolled the first 1,500 patients in the trial. They actually doubled the number of enrollees in the trial to make sure that they didn't see any of these uncommon vaccine complications like myocarditis. Now, in time, there might be a low rate of those, but I think the counter to that is, well, what if I don't get a vaccine but instead get COVID-19 infection? And what is the risk of myocarditis with that? And what we know fairly certainly by the literature is that the risk of myocarditis is greater with the COVID-19 infection than it is with the vaccine itself.
That's really important information. All right, Jimmy, I will throw it back to you.
Thank you very much, Monica. And I am here with Dr. Forbes. Doctor, a viewer writes in and is worried about the length of time in which data has been collected. So they write in and say, I don't want my child to be a science experiment for a vaccine that doesn't have any long-term data. How can you say this is safe?
Oh, that's a great question. It turns out the vaccine does what it does, and whatever effects happen from the vaccine happen fairly quickly within the first few weeks to maybe months. And after that, it's gone. In fact, if you notice, we're all getting boosters these days. That's because the effect of the vaccine wanes after it appears about 6 to 9 months. And so as far as long-term effects, We don't really think in terms of long-term effects because the vaccine doesn't really stick around that long.
And we roll along with more questions. Sarah and Dr. Giuliano are in the newsroom. Sarah, one more question before we take our first break.
We are getting some really great, important questions from you. Thank you so much for joining us tonight. So a quick question for you, Dr. Giuliano, about dosage size. We had a viewer ask, can the first dose be pediatric and the second dose adult?
Yes. So the recommendations are that you get the dose for the age that you are on the day of vaccination. So if you're 11 on day 1 for dose 1, you'll get that lower dose. And if you turn 12 between the two, then you will get the second dose to be a little bit higher.
So parents for tweens can have some confidence in, again, as soon as you have access to this vaccine, getting it.
Absolutely.
Even
yes.
21-day birthdays in between.
Right, right. And regardless of whether you're getting that 10 or 30 microgram dose, we know that it's effective, and we know that there's just slightly less risk of side effects at the lower dose. So I would definitely go ahead and get that first dose as soon as possible.
Absolutely. All right, Dr. Giuliano, thank you so much.